Hello, Savannah. My name is Pablo. I'm going to be your student one nurse today. I was just wondering if you could give me a quick SWOT report on the patient we're going to be seeing today.
Sure. Today we're going to be seeing patient's name is Ryder Kind. He's in room 620. I can give you some background information on him. He's a 67-year-old male, patient of Dr. K. Phillips with no known allergies, and he's a full code.
Okay.
He originally came in because he has a stage 2 ulcer on his right heel. He also has a history of type 1 diabetes, which he's been diagnosed with for 20 years. He was admitted to the floor after visiting his primary for the wound on his heel, and his blood sugars have been elevated above 300 for the past 5 days. He's alert and oriented ×3 with no neurological deficits. He wears glasses. He's got orders to be up as tolerated with a normal gait. He had complaints earlier of bilateral tingling in his lower legs. He's had that for a couple months, he said, about 3. And he also complained earlier about some pain in that right heel, so we gave him some morphine a little bit ago, and his pain went from a 6 to a 1. Lungs are clear with no cough. He's not a smoker. His O2 is 96 on room air. He's got normal heart sounds, plus 2 pulses throughout all his extremities, no edema. His cap refill is normal. His last blood pressure was 128/70, and his heart rate was 76. He's got active bowel sounds and a soft, non-tender abdomen. He's on a 1,800 calorie diabetic diet with a 2-gram sodium restriction. He has regular bowel movements. His last blood sugar was 290, so we're going to give him some insulin right now to cover that. He voids normally. His last urine output was 320, and it's normal yellow. We have a UA pending. He's got a right forearm IV 20 gauge.
Okay.
So pretty much he's here for glucose control, some diabetic teaching, because he mentioned to the doctor earlier that he hasn't been following a diabetic diet as strictly as he should.
All right.
He's also here for pain management and wound evaluation. We have a wound consult out for the wound care nurse for his ulcer on his heel. His labs are good. CBC and CMP is normal. His A1C was 6.5, which is elevated from 3 months ago. But again, he's had high blood sugars.
Okay.
And I have to go on and give him some insulin right now. We're giving him some regular insulin.
All right.
Any other
Excellent.
questions?
Yeah, I just have a couple for you.
Sure.
Why specifically is this client receiving this medication, and what action does the medication have on the body?
So he's a type 1 diabetic, which means his body doesn't naturally make insulin, so he has high blood glucose levels, and what that insulin is going to do is it's going to pull that glucose into the cell so the cells can use it.
Oh, okay. And just a few more questions. When should you question administering this medication, and does this medication have a therapeutic serum level? Also, which vital signs must be monitored, and which physiological parameters should be monitored when the medication is being administered?
So we want to question it if his blood glucose levels are within normal levels, which is about 60 to 100. His is 290, so it's elevated. There's really no serum labs that we monitor. His A1C tells us how his sugars have been in the past 3 months, but we need to know to administer insulin what his sugar is at now. And I want to make sure that he is alert-oriented, not showing signs of hypo or hyperglycemia, and that he understands why he's getting the medication.
Okay, all right, thank you. Just a couple more. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting, and also what interventions must be taught while taking this medication safely at home?
So in the hospital, he should always question what kind of medication he's getting, how many units, make sure that the nurse is checking his name and all that stuff, and that they've got the right patient. And then at home, you always want to make sure you check your blood glucose levels before administering insulin. You also want to be careful for lipodystrophy. You want to rotate sites where you give your insulin so you don't get buildup of that at home.
All right, excellent. Just a couple more. What are the side effects and potential adverse reactions of this medication?
The main side effect is hypoglycemia, which patients can have nausea, vomiting, be diaphoretic, also have elevated heart rate with some palpitations.
Okay.
Those are the most common signs.
All right, and how will you know this medication is effective?
If his blood glucose levels decrease.
Okay. All right. Yeah, that's it. Thank you very much. That's all I need for now.
All right, so let's go and we'll give him some insulin.
All right. Excellent.
Knock, knock. Hi there. My name's Savannah. I'm going to be your nurse today. This is Pablo. He's a nursing student. He's following me around, learning some things.
Hello, sir. How are you?
Doing good, sir. Thank you.
How are you doing today?
Doing great. Thanks.
All right, so I have some insulin for you.
Okay.
You're going to get your regular insulin. Do you have any questions about it before I give it to you? All right. Let's check your name and date. And how old are you?
67.
And what's your name?
Kind writer.
Alright. And do you normally take this insulin home?
Yeah.
And do you have any allergies?
No.
Okay, monitor all So your blood sugar, the last reading we did a couple minutes ago was 290. So it looks like that's high. Looks like based on the doctor's orders, you're on sliding scale, so we're going to give you 16 units today.
Okay.
When should we question administration and does the medication
And I have your dinner tray on the way. Should be here shortly. I'm just going to scan your armband. And one more time, can you tell me your name and your age?
Kind writer, 67.
Do that one more time. And I'm going to check my meds. I'm going to check my expiration date, the clarity and the color of it. Make sure it's not cloudy or anything.
So your sugar, when they tested it, was 290. So we're gonna do.
And where would you prefer your insulin to be given?
Abdomen.
And you're familiar with this insulin, right?
Yes, I've taken it for
16
20 years.
units. First, we're going to put in some air.
Do you have any questions about it?
No, but it's on my regular insulin.
Yeah, it's your regular insulin.
Okay, no question.
Okay.
Checking again.
So before I give, we've got 16 units here, regular insulin. And the patient write the times and check the doctor's orders. We're given 16 units, sliding scale because of the sugar of 290.
Okay.
Alright. Quick poke here.
And then what are the?
How'd that feel? Any pain or anything?
Nope. Not at all.
And these are outside the.
And right now, just the time I give it, we're going to give it to you.
Okay.
I've got some teaching here for you too about your diet because I was told you weren't following your diet as strictly as you should have been lately. Is that
I
correct?
know. Yes. It's one of those things.
Do you have any questions about it?
Yeah, I prefer it in my abdomen.
You want it on the left or the right?
We'll go to the right.
Haven't used the right in a while.
We're still waiting on the
Last time was
the
yesterday.
lab, so we may
Can you
reassess
tell me your name and
my
date of birth?
accuracy once we get
It's gonna be Ryder Kind, and I'm 67 years old.
And no allergies, right?
No?
Let me see you have.
I should do that. I should be like, no.
One.
Yeah.
And then we should go.
Alright. So here for you is that teaching. And again, it just goes over carbohydrates, what you can and can't eat, how many grams and stuff you should have, and what you need for your body. Any questions?
No, ma'am. Thank you so much.
Alright, how's that pain in your foot? Is it still okay?
It's okay right now.
Alright. I'm gonna go check on your dinner tray.
Okay, okay.
We'll be back in a little bit.
Awesome.
Thank you, sir.
So much.
Thank you.
Yep. Thank you. Appreciate it.
Mm-hmm.
Alright. Any more questions?
Just a couple more.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client's medication?
You always review the doctor's orders first off, and as well as the blood sugar levels because you had a sliding scale ordered, so you want to see how many units you're going to administer with the sliding scale.
Okay. Also, did this information affect your decision to administer the medication?
No, because his blood glucose levels were high, so we wanted to give him something to decrease those levels.
All right. And did this information affect how you administered the medication?
I always take into mind where the client wants it given, because you can give insulin in many different places, so you always want to make sure you ask first. He preferred his abdomen, so we give it in the abdomen.
All right. Yeah, those are all my questions. Thank you so much for having me today.
Thank you so much.
All right. Have a good one.